Many of my clients were asking about the Medicare prescription drug and the Inflation Reduction Act and how it's helping adults. Now, for the entire program, it is helping everybody, not just low income individuals. In this kind of flyer fact sheet that was prepared from Justice and Aging, they talk about how the Extra Help program is being expanded. So right now for Extra Help, what that is a prescription drug help program for people who make under about $1,700 a month and have less than about $12,000 of assets. So it's not a lot of money. The numbers do change every year, go a little bit higher based off inflation, but it's not a whole lot. In 2024, which is not next year but the following year, that asset threshold will be increased to 150% of the poverty level, which is pretty good because right now it's set at 100%. So we're increasing it by a bit. And it will provide additional support to more than 400,000 folks who are on Medicare right now who don't qualify currently for low-income subsidy. Next, as many of you folks know, hopefully you found out from me or from watching the news, vaccinations on Medicare Part B and for Part D are being eliminated. Before, you had to pay a deductible and potentially a copay, probably a copay, when getting vaccines like the shingles vaccination or sometimes even flu vaccinations. Now all of that on Medicare Part B and D will be at no cost. Lower prescription drug prices, so Medicare will be able to negotiate some of the costs or some of the prices that drugs are in 2020. I believe they're starting 2023 and they're expanding it, the amount of drugs that they can negotiate on every year. Now, this doesn't mean that the drugs are going to be much cheaper or super cheap. It just means that they're going to be negotiated, and the inflation or the rate at which these drug prices do go up cannot reach a certain amount. I did an entire video about how they do that entire process. You can check it, or I'll try and link it below here. The next thing that they did doesn't really affect people who are on Medicare, but for everyone who is on the ACA, the premium tax credits for the Affordable Care Act is going to be extended from 2023 through 2025, so an additional 3 more years. So that would help for people who are still shopping and looking for medical insurance, but yet who are not on the Medicare. So this is Cost Plus Drugs, and Cost Plus Drugs has basically made a pharmacy where you can put in your medications, find out if they have it. You do have to register for an online account, and the way that they, I guess, charge you, so let's just do lisinopril. So lisinopril, if you take, let's just call it 20 milligrams, and you need a 90-day supply, 90 count, you take 20 milligrams a day, it's $6.60 to buy. And this is how they do it. And if you were to buy this for cash or for with using insurance, it might be $101. It could be as high as $101. So you can check. This is how they break down the cost. So the manufacturing cost of this medication is $2.70. They charge a 15% markup. That's like Cost Plus Drugs fee. The pharmacy labor, which also has a fee associated to it because the pharmacy has to, there has to be somebody that package the medication, a licensed pharmacist, usually a pharmacy tech, and then it has to be shipped to you. So all in all, this entire process, 90-day supply, might cost you about $6.60 plus shipping. If you can combine medications together, like let's say you have the lisinopril and you have the losartan and you have maybe a statin, you can combine all the medications and get a lower shipping rate. Also, if you do 90-day supplies, you don't have to do it 4 times a year, so it cuts back on that. So take a look for all of your maintenance medications. This might be a cheaper option if you currently are paying for your generic medications. If you're paying like a $10 copay or something, or $15 copay, or maybe even like a $30 copay for generic medications. Check here first. You can just simply check by typing in the medication's name. The other thing that I've been helping people with is single care. Single care helps people who need medications, like let's say the Cinepril. Again, we use the same drug, and if you needed that same prescription of 20 milligrams, 90 count, the Cinepril would be just a little bit cheaper, $4.87. You don't have to have any insurance. This is the same 90-day supply. Walmart is $10, CVS is $12. So you can see how it's cheaper here, and you can compare and contrast all of these different websites. Single care is what I use now. GoodRx is something I used to use before. Well, I still use it intermittently if I feel like the prices are, kind of off. Look, listen. Oh, but actually, I need a 90 tablet. So you'll see at Safeway it's $7.22, but with single care it's $4.87, so it's a little bit cheaper. And I found that recently, as you can see here, GoodRx has a paid version, so you can sign up for the paid version on GoodRx, and then you get a better deal. So this one doesn't have a paid version, so the deal is kind of going to be the best that they can do, whereas GoodRx gives you the best that they can do if you buy their subscription service. Something else you can do to save money on prescription drugs. The other way, of course, is to go to MatthewRaguda.com/enroll and then find the most advantageous drug plan by putting in your medications. Now you can use either my website or you can go to Medicare.gov to use theirs. Just full disclosure, my website doesn't allow you to view everything, whereas Medicare.gov does, but Medicare.gov does have its limitations as well. So it's up to you. You can use both, like how I use both of these and cost plus drugs, but if you want to save money, that is usually the best way to do it. I hope this video helps. Happy Thanksgiving, happy Fibonacci Day, and we'll see you in the next video. Hello everyone, so today is November 23rd. It is what's called Fibonacci Day, and so I figured I would have some of these nice Fibonacci images. You can go ahead and check them out. Oop, my mouse is getting all crazy here. Other images. The Fibonacci sequence, for you guys who don't know, is a sequence that happens a lot in nature. And there it is. The way each number is created is you start off at 0 and 1, and then the next number is the combination of the prior two numbers. So 0, 1, then you got 1 plus 0 is 1, 1 plus 1 is 2, 2 plus 1 is 3, 3 plus 2 is 5, 5 plus all the way up until it's done. And that's known as the Fibonacci sequence. It's also used in retracements and expansions and extensions in trading. So I frequently will use the Fibonacci sequence to, find support and resistance levels at key areas. We have the golden ratio, which basically is the Fibonacci sequence. You can see here, this is how it's formed, and it's based off Ralph. His name was Ralph. Let me see what his name was. The dude that did the Fibonacci's. Nope. Should have known. His name is Leonardo. Leonardo Fibonacci or Leonardo Bonacci. He invented this pattern. And today, because it's 1, 1, 2, 3, is Fibonacci Day. And Fibonacci sequence is used in nature. It's also used in things like computing, mathematics. So it's a pretty important number. You can learn the sequence. It's super easy. I mentioned it earlier. The next number is the first two numbers added together, and it just keeps spiraling on and on and on forever and ever and ever. And you can find nature sequences and mathematical sequences that are based off of it. So now on to what we're supposed to talk about.